On March 21st, 2024, I began a journey called neurofeedback. This is my journey of neurofeedback, and I want to share this with you. I'm not going to share everything with you, but mostly everything, because I'm going to be doing a series of videos where if you're interested and you want to watch it, then you can reach out to me and we can watch it together. So, I have experienced in the last couple months an incredible change in me, and I really do believe that this is my journey, but you might want to see these classes and kind of put yourself in, is this something I'm experiencing? Am I suffering from neurological decline? Am I experiencing epilepsy, learning disabilities, ADHD, neuromuscular disorders, autism? I already said ADHD, brain tumors, cerebral palsy. These are just to name a few. It could just be that you want to sharpen your mind just a little bit. Well, I've seen incredible change in me. Uh, uh, It's I'm actually surprised. I was kind of skeptical when I first started this. And so today we're going to be talking about this journey and where I'm at today with none other Dr. John Silva. He is the one that is going through this process with me. He does this with so many people all over the world. And so I'm bringing this out there to you so that this is an option that is non-invasive and you can do it in the privacy of your own home. So today, Dr. Silva is going to be talking about my journey as well as your potential journey.
And when you need a friend, you can count on me. I'll be right here, waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach and the host of the Lillian McDermott radio show Classroom. If this is the first time that you've been in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, by listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. As I mentioned to you, it's been several months since I started neurofeedback. I did not believe that I could change a lot. It is amazing how we get used to our handicaps, that we get used to our disabilities, we get used to our, that when we're not optimal, we get used to it and that becomes our new norm. And then all of a sudden something comes along which allows you to change, and you realize, wow, I didn't realize I was sick, or wow, I didn't realize I had so much cognitive decline. Well, that's what this is, what I've been experiencing. And so I am just so grateful that I get to, this will be like the third time Dr. Silva comes in the classroom, and I'm hoping that he will continue to join us every month to share how others are going through this experience as well, called neurofeedback. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. John Silva is here to do just that. Welcome, Dr. Silva, to the classroom.
Thank you again, Lily. It's great to be back for our third
Yes,
month.
yes, exactly. Well, here's the deal that people don't understand or don't know yet. Dr. Silva and I met prior to recording this class, and we recorded the session of my what's been going on in my brain. And let me tell you, it's changed exponentially. At least I think it's changed a lot. So share a little bit about neurofeedback, and then we talk about some of the changes that you've seen in me when it comes to the results. So share a little bit about
Sure.
neurofeedback and your
Yeah.
background and what people should expect when learning about or trying neurofeedback as well.
Okay. I guess we'll start with my background. So, as I like to say, I'm a chiropractic physician by trade. What does that have to do with the brain or neurofeedback, which I'll get into? But the whole premise of chiropractic training as we go through schooling and then our practice is about influencing and improving neurological function predominantly through the spinal cord, which is housed in the spinal column. And we make spinal adjustments to help people not only alleviate their pain, but there's so much more to it. So already have, as chiropractic physicians, a good background, working knowledge and education on how to identify neurological patterns that are disrupted in the body, and improve those through chiropractic treatment. But as through my whole schooling career, I started back in the 20s, or back in my 20s. I just never stopped learning. So I continued postgraduate training. I still continue my postgraduate training. And I just always had this fascination for what's called functional medicine, and an emphasis on the neurological system, as a whole, looking at the whole body, how the neurological system plays a role in our healing and well-being. And then in more recent years, last probably 15 years of practicing, I've put even that much more emphasis on the ultimate part of our central nervous system, or nervous system, which is our brain, command central, as I like to call it. And it's interesting because we don't really stop to think about our brains all that often until, God forbid, we have an injury to our head, and then we suffer the consequences. And now we're starting to think about our brain, or perhaps we're starting to be more forgetful, having memory issues, whether we're young, and because I'm seeing a lot more younger people now, I'm talking like 30s, having memory issues that you normally would not see. Although I don't even like to use the word normal, because it's not normal. It might be common, but it's not normal to have memory decline at any age. Okay. And I know that for certain because that's just how we are built as human beings. It's how our physiology, our genetics are built. And you may know, and I'm sure the people listening know, of people well into their 90s. I know a gal that's been on my chiropractic part of my practice, been with me for years. She just turns 102 this year, and she is sharp as a tack. I mean, it's incredible.
Wow.
She's
Wow.
witty. She's having some physical limitations and problems, but her brain is all together, and that's how we should live our entire life. There's
Yeah.
So again, I say it's common that we're seeing so many people, including younger people now, suffering with cognitive decline, focus issues,
Yeah.
attention issues, of course, emotional behavioral problems, but it's not normal by all means. So where is this coming from? It's coming from the brain. So yeah, that's one of my practices, really evolved in the last, like I said, 15 years or so. And it's predominantly all I do now is again still a whole body approach, but with an emphasis on the neurological system, specifically the brain, to help people get to a better place in their life. Okay. So the primary therapy that I offer is called neurofeedback therapy, or commonly referred to also as neurofeedback training. So just a little insight, little history on that. So neurofeedback therapy has been around since about the 1960s. So it's been around for quite some time. Of course, it's become much more advanced with advancements in computer technology, microprocessing abilities, and just neuroscience in of itself has really changed the landscape when it comes to neurofeedback. And it's evolved so much so that in the last 5 to 6 years, what would traditionally be done in a clinical setting, where someone would come to a clinic like mine, a neurofeedback clinic, and they would do a neurofeedback session, which we'll get into in a moment, which is usually about a half hour, where they're listening to music or watching some type of imagery or a video on a screen. They would do that 2 to 3 times a week for several weeks or several months. Well, the neat thing is, in the last, like I said, 5 to 6 years, there are technologies now that have been developed that take that clinical neurofeedback training session and put it in a home environment remotely. So it's given me the ability, and the experience to work with people, not just here in my home state of Florida, but beyond Florida, throughout the nation. And I even work and consult with clients worldwide. So you actually commented on the map in my office the other day when you came
Yeah.
in, your interim brain map. Uh, those are all the places I have not traveled. I want to travel, but those push pins in the world map represent the clients that I've worked with over the last 6 years worldwide. So it's been a cool experience, a really cool experience, to
Yeah.
know that I can look at people's brain functions while they're over in Australia.
Yeah,
It's
absolutely.
quite fascinating. So yeah, so neurofeedback therapy is predominantly what I offer. I still have a lot of other therapies that I have been trained on. And again, these are all non-invasive functional medicine, if you want to call it, type interventions and therapies that, and even those beyond neurofeedback training, can also be done in a home setting.
Yeah.
So take, for instance,
Avasia.
In my practice evolution over the years, I used to do hyperbaric oxygen therapy.
Yeah.
We had a mild hyperbaric chamber. I had two of them in my
Wow.
clinical practice when I had full staff and such. But even that has evolved into oxygen-based therapies that people can do from home, either with hyperbaric, because they're relatively inexpensive, but there's even less expensive ways to deliver high concentrations of oxygen to the body where that is needed most, especially for neurological conditions or other chronic conditions. So I consult people with these things that are accessible to all of us in a home setting. So it's
Yeah.
really changed the landscape of healthcare at large, but especially in our realm of functional medicine, where these therapies and technologies like oxygen and neurofeedback can now be done from home with the consultation and guidance of a physician like myself.
Yeah,
So
and of course I met you as because of Avasia. I was
yes,
taking a course, and that is something that people can do at home as well.
yeah,
And I know that the microcurrent has completely changed my life. One of the reasons that I wanted to come to you and have the looking after what's been happening in my brain is that back in 2017, that's when I met you. And I went to my first class for Avasia because I was bringing it to doctors. And they said, well, why don't you try it? And so why don't you take a course and see, so you can learn more when you bring it to the doctors. And I was all in, and you were the one that presented that day. And I will always remember there was a girl with scoliosis. I don't know
mhm,
if you remember that,
yes,
but
I
she
do.
had a pretty big curvature in her spine, and within an I don't know how long it had, like 20 minutes, 30 minutes, we were able to see the spine kind of straighten up. Now, that needs to continue so that the spine will continue to change, but I remember that blew me away.
Yeah.
And in the training, and 3 months after that, after I bought my first unit, I was rear-ended, and that's one of the traumatic brain injuries that I experienced. I had a concussion, four herniated discs. There were so many different things that happened as a result of that. But there was another time that I fell down a flight of stairs. So and that potentially could have caused it. But what after the accident, I couldn't remember. I couldn't remember certain words,
Hmm.
and here I am trying to do the show at the time, and traveling to Jacksonville because my schedule was so aggressive. And so something like that, to have that at home, allowed me to treat myself, much more, which I love the neurofeedback. I can do that at home as well. It's just been wonderful. And I've seen a difference in me, just like I saw a difference with me and Avasia. So both times you have been very impactful in my life. Because when I went back to kind of retrain, you were there. And one of the reasons I did go is because I knew you were going to be there. And I loved learning with you and from you. And that's when we started talking about, that's when you started saying, hey, I'm doing this now. And here you are. And now I'm going through this experience with neurofeedback. And I want to kind of reach out to you, the audience, and say, are you experiencing some deficiencies that have become a norm for you? Write those down and see if this is normal, and if it can be worked on with neurofeedback. Can neurofeedback help you? So one of the things, as you were talking in your intro, Dr. Silva, is that you had mentioned pain.
Hmm.
Can neurofeedback help desensitize some of our pain receptors that might be enhanced? Can addictions, if someone that has an addiction or someone with ADHD, let's talk about some of
Sure.
the benefits for some of these um, I guess side effects that we've been experiencing, that we just say, oh yeah, it's par for the course, it's
Yeah.
normal. But you're saying it's not normal,
No, it's not.
just
It's not.
common.
Yeah.
Yeah.
Yeah. Common. And again, through all age categories. I mean, I'm working with a lot of kids now with a lot of neurodevelopmental problems, and it's common, but it's definitely not normal. And as I've stated for many years, and again through my postgraduate training, we've those of us, especially in the realm of functional neurology, we've been seeing this wave of this upcoming neurological epidemic. The statistics have been there for a long time, and now we're really seeing it, especially after these COVID times. I mean, COVID itself, now there's a diagnosis of long COVID, and it especially has an impact on brain neurological function. So we're seeing what was already in place prior to 2020 just amplified at magnitudes that are really scary. And younger kids, young adults, and are just suffering as they should not be suffering at any age. So now is the time to take action wherever you might be in your day-to-day life. So talk about chronic pain. Let's just take that for instance. So, and I'll give a case study here, which is quite fascinating. So yes, by getting the brain in a better functioning state, which is what neurofeedback therapy is all about, we can actually help to minimize our perception of pain, wherever that pain may be in our body. And in some cases, I can't always guarantee this, I have actually seen pain completely gone away just through working on getting the brain functioning better. Now, how does that make sense? How would that work? How can that help with pain? Well, if you really stop and consider our brain, and I like to kind of look at things from a very simplistic standpoint. So our brain is responsible for basically four primary functions throughout our entire body. But one, it's our cognitive abilities. Okay, so things like attention, focus, our ability to have memories, whether it be long-term, short-term memories, word retrieval, all our cognitive abilities, just our ability to have a conversation right now, or someone tuning in through a podcast, maybe driving their car. You're experiencing a number of different cognitive functions all at one time. You're paying attention to the road, hopefully. You're listening to new information. Your brain is processing that, putting some of this information into long-term and short-term memory. These are all cognitive functions, okay? So that's number one. Secondly, our brain is also our emotional self, okay? And with any of these categories, which I will continue to discuss, it's all about balance, okay? So we should have proper cognitive functions throughout our life. Same thing with emotions. We don't want to be overly anxious or stressed and be in that state of fight flight. And we also don't want to be in a state of depression. And I work with a lot of people that have a mix of both of those things. But ultimately, where do our emotions come from? Our emotional well-being, that regulation comes from our brain. Our emotions come from our brain, okay? So we have our cognitive self, or emotional well-being, and then behaviors. Our behaviors are processed through our brains as well. And again, it's all about this balance. And especially with children, parents bring their children into me. One of the common reasons why is because their child is very disruptive. Their behavioral patterns are just off the chain. And it's not that the child has put themselves in this position, it's their brain is just so dysfunctional. And we can clearly see that when we make these measures through qEEG brain mapping. And you can see where these behavioral patterns set in because their brain just not functioning properly. Start getting the brain functioning properly through interventions like neurofeedback, and you see this child's behavior go into a better regulated state. Okay, what it would normally be for a 6-year-old or a 10-year-old or even a teenager's behaviors to be. Okay, and again, this also manifests in adults as well. So we have cognitive functions, emotional functions, behavioral functions. And then lastly, our brain is also responsible for every other physiological function in the body from head to toe. So whether it be your last meal digesting through your gastrointestinal system, that ultimately is all controlled and masterfully conducted through our brain function and our central nervous system. Our heart beating right now and our ability to regulate blood pressure. Yes, it's our cardiovascular system, our heart, our blood vessels, but ultimately it's under command of our brain, our central nervous system. So if we really stop and think about the importance of that one part of our body that rests between our ears, you really start to say, wow, this is something I need to pay more attention to, whether it be in my just day-to-day affairs, my day-to-day thought patterns. Thoughts originate from our brain.
Yeah.
So you really start to think and wonder like, wow, yeah, I never really thought much about our brain from that perspective. I know it seems simplistic, but sometimes we have to go back to simplicity. But again, it's usually in times of concussion or significant events in our life where we have a lot of anxiety and panic, or we're in a state of deep depression, that maybe we start to look at our brain as a responsible part of our brain, or the culprit, so to speak. But even then, what do we usually reach for? We reach for the standard stuff and try to take some medications to alleviate the symptoms, which is an expression of the brain not functioning properly. So I just figured we take a little moment to just discuss the basics of brain function. So coming back to chronic pain,
Yeah.
we know to be a part of our brain. In fact, it's right along the top of our brain, called the sensory motor integration area, the sensory motor strip. This is where our brain takes in incoming sensory input from our five senses, but also from all the different parts of our body. And I like to call it the first order of processing. Neurological processing takes place in that part of the brain. And then there's a corresponding what we call motor output from that part of the brain once the brain has done its functions, and this is all happening at lightning speed. This is incredible. It's all electricity bouncing around in the nerve cells and neurons in our brain, but then there's a corresponding motor output. And it's our ability to walk, our ability to talk, to do all of our daily physical functions. But here, that part of the brain can be disrupted, and it can become dysregulated, is the word I like to use. I mean, this is measurable. And when that part of the brain becomes dysregulated, we can start to have manifestation of pain, or enhanced sensation of pain that may not be as real as the next person who perhaps has the same injury or pain in the same region of the body. So let me relate this to a case example. So this is probably back in 2018 when I was actively had my clinical practice, and people would come in to see us for neurofeedback sessions. And I had a gal come in. She worked for a local hospital in the administrative department, and high stress job, just always on, a lot of hours. And she predominantly came to see me because of this anxiety, this high level stress, sleep issues, much like yourself. And as kind of like a secondary, even tertiary thing, which we didn't really even discuss much on her workup, is she had this chronic right foot and ankle pain. Again, my main focus was looking at her brain function, helping her through her anxiety, her sleep issues, getting the stress level down, which she did very well with. But it was I think about 4 to 6 weeks into her neurofeedback sessions, and she would come in 3 times a week for her sessions, that she made a comment, or a question really. Is it possible, doc, that my right foot and ankle pain, which I've had chronically for years, could be getting better? So I had this discussion as we're discussing now, and gave her a little background on how her brain functions, pulled out her previous brain map, showed her some of the dysregulatory patterns in that part of her brain, the sensory motor integration area, and made that connection for her. And that was powerful in of itself. Call it placebo, call it whatever you want, but just the thoughts that, hey, I'm doing something good here. I'm helping my anxiety, my stress, my sleep. That I know is improving, but that it all is coming ultimately from my brain, because our brain
Right.
is where we perceive our pain. It's what
Well, but you know
is
what? Even if you want to call it placebo, it's still working.
still working.
I
Yeah.
always think that placebo is so dismissive. You know, it's like, oh, it's placebo effect. Well, it's working. So that means the brain has much higher power than whatever pill that could be given. You know what I
Yes.
mean? So
Yeah.
keep
Yeah.
going, because this is
Yeah.
very
No, that's
interesting to me.
exactly right.
Yeah.
So interestingly enough, as we completed her neurofeedback therapy program, again, her main objectives and my main focus for her was what she came to see me for. The anxiety, stress levels, all that was resolved. Interestingly enough, her pain levels in her foot and ankle, she commented, were about 80% better. And the interesting thing is, and I have plenty of home-based therapies, and even at that time, in-office therapies that could have helped work on the direct source of her pain, which again was her right foot, and was a result of the previous injuries that she had throughout her lifetime. But we never even used those therapies, never even touched that part of her body.
Wow.
Just through
Wow.
getting her brain in a better functioning state, she was able to relieve a good portion of that chronic pain. And interestingly enough, too, again, she works at a hospital, so she had gone to the orthopedist there. She had numerous diagnostics. She had gone through standard physical therapy. She had I think she even had a minor surgery done to
Mm.
no avail. She still had this chronic pain. And here comes along neurofeedback therapy, which was helping to address her, again, her bigger issues, but her chronic pain was able to almost completely resolve. So just, and again, I've
Wow.
seen many case examples of this in my clinical practice. But
Wow.
yeah, so since you brought it up, I figured we touch on that. So it
No,
does
no, no.
have a place for
And I
chronic
love
pain.
how, yeah, I love how you talked about the purpose of the brain and the, just to know what our functioning process of our brain is. And as you were talking about that, I started thinking, if I were to slice, in which I used to work for an imaging center, and that was one of the terminology
Yep.
that they would slice the brain into little sections like that. You don't see pain. You don't see thoughts. You
Mhm.
don't see addiction. You don't see depression, anxiety. You don't see it. Where is it? Where is it
Yes.
housed?
Yeah, so you bring up a great point. I'm glad you brought that up. So you're what we're looking at, and those are typical diagnostics. When you
Yes.
have a head injury, they even run some of those diagnostics that perhaps people have cognitive issues,
Yeah.
anxiety, depression. Usually they come back negative or with very minimal findings. And the simple reason is we're looking at the brain from the perspective of its structure, its anatomical structure. And in most cases, we are not going to see something when it comes to your
Yeah.
run of the mill ADD, ADHD, depression,
Yeah.
anxiety. You're not going to see that. So, how can we assess that? We have to look at the function of our brain. Okay. Now there are numerous diagnostics that can look at function that go beyond your anatomical, your structural things like MRI and CT scans. In fact, there's what's called SPECT scan, which is almost like a form of an MRI or CT scan, which now starts to look at blood flow in the different regions of the brain. Now we're getting closer to looking at function as it may relate to a cognitive challenge or an emotional or behavioral challenge.
Mm-hmm. Mm-hmm.
There's also what's called functional MRIs. Again, an MRI, but looking at, again, metabolic activity in the brain. So these things do exist. Again, not typically ordered, unfortunately, by most physicians. You have to kind of seek this stuff out.
Yeah.
But the one diagnostic that has withstood the test of time is probably older than any of those things is EEG or electroencephalogram. It's a non-invasive way to use electrodes or sensors placed on the scalp that correspond to each part of the brain to measure the electrical activity of our brain. And that's ultimately what our brain is doing. It's producing electricity, which is measured in microvoltage. And that's what we measure on EEG. And EEG was developed, I think, if my memory recalls, back in the 1920s. So it's an old technology, of course, come a long way. It's much more advanced than it ever was.
Yeah.
But the first EEGs ever measured were back in the 1920s.
Wow.
And
It's
even in
amazing.
this day, yeah, even now, if you were to go to, say, for instance, a neurologist who typically will do a EEG, or if you went to a hospital because of a head injury or trauma,
Yeah.
that's about the only time they run an EEG is in those circumstances, or perhaps you have a significant neurological problem, such as seizures or epilepsy, and then they'll run an EEG, which again is great. At least we're getting closer to understanding what's going on. So that's what it's all about is looking at brain function, and that can shed so much more light
Yeah.
as to why a person is struggling
You
again
know,
with pain, depression, anxiety, you name it. There's a whole plethora of
yeah,
things.
it's fascinating. This has been a really incredible experience for me, by the way. I just want to thank you for that. But you had mentioned functional MRI. Now, I was diagnosed from that car accident. Remember, I told you about the car
Yeah,
accident. I had a lot of cognitive decline. I mean, I noticed it because, when you're doing a show, when you're on the air and you're live on the radio or whatever, and you can't even think of a word, that's not good. You don't want that kind of silence on your show. And I was noticing it more and more, and I couldn't cover it up anymore. And so I had gone to a neurologist, but he's a different kind of neurologist. I can't
hmm
remember what at the time the particular kind of neurologist he is. And so they did a brain scan on me just to see the functionality of the brain scan.
yeah,
And they did a dye. They did actually, I don't know if they did a dye or not at the time. I think they put a dye in gadolinium or something like that,
Yeah.
which after that I found out, you don't want to do gadolinium. And so my results were that they couldn't see anything major, but they said there was an incidental finding of a mass in my brain by my pituitary gland, by the pituitary. And so it was like, oh my gosh, so they had to continue monitoring it, making sure. It could have been that was there my entire life, but it was an incidental finding.
Yeah.
And so because I've had to go back and just make sure that it doesn't grow, even if it's benign, if it grows, it's in a place in the brain. It's called the clivid, the clivus.
Yes.
And so it's in a place where if it grows any, it could cause a lot of problems in my body. So I think of it as that it's actually shrunk, and they found it as it got shrunk because I dealt with so many other things in my life, so that little thing just kept getting smaller and smaller and smaller. But as I retest, they will not allow me to do a functional MRI. A functional MRI is how it used to be. And they could tell the contrast without contrast. You could just turn it up and turn it down. Now they force you to do the gadolinium, or they won't do it at all. But here's a tip for those of you that don't want to do the gadolinium. I don't know if I'm saying this correctly, Dr. Silva, so correct me if I'm wrong. But Dr. Lee Cowden is the one that gave me the tip that if you go to any working hospital, like a university hospital, they always have a functional MRI. You need to call in, find out if they have those are the places that are going to have it.
Yeah.
But the doctor, the neurosurgeon that I go to now, he wouldn't let me do it. He wouldn't allow it. So just have to understand, we got to work the system too.
Yeah.
Just because one doctor says you have to do this doesn't mean you have to expose your brain to that kind of chemical. Do you know anything about the gadolinium and what it could cause in the brain in the future? Do you know anything about those results or side effects?
Not specifically, but I know it's something you want to limit.
Yes, yes.
Probably
Just
don't
like
want to do
CTs,
those
just like
frequently.
CTs.
Yes. Yeah.
So let's go back. I didn't mean to get on a
No,
sidetrack there,
that's
but
okay.
because I just know that there are people that are experiencing like, for example, someone that has brain cancer. I've been working with somebody that has glioblastoma and was given a short period of time to live if he didn't do chemotherapy and radiation. He opted not for. His name is Pablo Kelly. He's in Ireland, and it's been 10 years. And he's lived with glioblastoma for 10 years, and rather successfully. There are side effects to some of the surgeries that he's had to have, but his eating shrunk the tumor. There's other things that people are told that they have to do. So when somebody's having cognitive decline, when people are having anxiety, depression, the doctors are, and this is the reason why I'm building up to this, the doctors are going to give them the allopathic solution, which is to take a pill, to have surgery, to take it off, burn it off, do whatever it is. So have you seen in other situations where people have said, I refuse to do this, opting for feedback by neurofeedback? And have you seen any results with that? Can you think of any type of situation where the only option that was given to someone, and what condition they may have had, which was something more invasive?
Yeah. Well, I mean, consider much of this subdivision. If you take healthcare at large and look at the realm of psychiatric or psychiatric care, um, all this comes from, again, whether it's anxiety, depression, and again, the typical course of therapy is going to be some type of intervention, usually medications, first line defense. Maybe we'll combine that with some counseling or therapy. So you go to a psychologist, psychiatrist, or even a therapist. And I'm not knocking any of this stuff. It can serve people well. But here's an interesting thing, and I'll just back up on that, is take that one part of or one sector of our healthcare system. And I learned this from Dr. Daniel Amen. For anyone that might be listening, that's where I learned a lot, and that's where my fascination for the brain really started to come from. I remember watching him on his PBS episodes years ago when he used to be on PBS, and then bought some of his books and looked at his work, and really fascinating. But he does SPECT scans in his clinical practice, and again, way of looking at measuring function. But he is a psychologist himself, and he says that it's one part of our healthcare system where the person attempting to help the patient
Yeah,
doesn't even bother to look at the actual part of the body that is
correct,
dysregulated or dysfunctioning before they prescribe an intervention such as a
correct.
medication. It makes no
Yeah,
sense.
yeah,
Again, you wouldn't expect that at a cardiologist. You go to a cardiologist, what are you expecting?
you have to have
Looking at
numbers.
blood
Yeah,
pressure, blood chemistry. We're going to do probably an ECG or an EKG. We're going to look at the function of the heart, the cardiovascular system. We're going to run these diagnostics before we make a determination of what you have going on, which would then dictate the medication or whatever course of intervention. Yet you go to this realm of health sciences, and we're not going to bother to look at brain function.
no,
We're just going to
no.
surpass that and just say, based on your conversation with me for a short 10 minutes, now it's even done by phone. I mean, I talk to people literally that have a 10-minute consult. They're given a diagnosis of PTSD or different depression. They even subdivide these depressions into different categories. And here's a medication to suit your needs, and we'll monitor to see how that works. Meanwhile, there's been no look at how your body's physiology, but especially your brain physiology, is doing that would cause that. And
Yeah.
that right there just is baffling to me, as it is most people when they stop to think about that. There's a great documentary I recommend people take a look at that came out back in, I think, 2012. It's accessible on YouTube, at least the last time I checked several weeks ago. It's called Making a Killing: The Untold Story of the Psychotropic or Psychiatric Medicine Field is the subtitle, but it's called Making a Killing. It is quite an exposure, quite an eye opener, as
Wow.
to the history of that part of our healthcare system, or sick care system, as I like to call it. Yeah, it dates back to the late 60s, early 70s, and how they kind of formulated this whole plan to be able to create all these medications for everything, literally everything. I mean, they
Yeah.
have diagnoses. If you do poorly in math, they have a diagnosis for you, and there might be a future medication or gene therapy for that.
And now
Okay.
shots and all that. There
Yes,
were there's
yes. I mean,
I want to add to what you just said, making a killing. So I've been working with someone that is choosing to do an allopathic route, and that's their choice. But the medication that they're taking is creating more symptoms than they had originally. It's creating a whole set of issues. So when somebody's taking psychotropic drugs, somebody's taking, and I'm not knocking it. If somebody is taking it, that's fine. But what is that doing to the brain? When you're looking at how to kind of like create this neuroplasticity, you're doing something totally different that's non-invasive, and the body is kind of working on our behalf to improve our cognitive skills, to improve our calmness, and not have all these emotional
yeah.
ups and downs. And you're doing this naturally. What are these psychotropic, what are these drugs actually doing to the brain that is not being monitored either, that a side effect might be
Hmm.
suicidal tendencies?
Yeah, which is very common with so many of these psychotropic medications, especially for things like depression, anxiety, even some of the ADHD medications. They can get quite strong. It's amazing that they're giving them to little children. I mean, we're talking classification of drugs in what are called methamphetamines. They're they're very stimulatory to the central nervous system of the brain. To put a 5 or 6 year old child on these things is just insane to me. But again, if there is a parent listening and you have had no choice, maybe you didn't have the knowledge,
Or
I'm
didn't
not
know?
saying to
Yeah,
stop
yeah,
these things,
yeah,
but realize there is a better way. So let's discuss medication. So again, I'm not trained, that's not my background,
sure.
but my basic understanding, as I think most people's basic understanding, especially in psychotropic medications, is we are chemically altering how the brain is functioning for a duration. Because you have to remember, these medications eventually wear off, and that's why you have to take the prescribed dose either twice daily, once daily. And at some point, that medication, and you can ask most people, that medication's effect starts to diminish. So this is where people typically have to have that increased dosage or increase um, um, frequency of taking the medication. And for some people, they have to then add to that medication because the one isn't working. And I've worked with people that come to my practice with a laundry list of medications, and yet they're still suffering, if not worse, because as you mentioned, Lily, now they're experiencing the side effects. I always come back to just simple things. I still have made this challenge. I've been doing it for years in my lectures, my courses, and podcasts. Go out there and find me a single medication. Doesn't matter whether it's in the psychotropic realm or otherwise. Find me a medication that does not have at least one side effect listed. Okay. It doesn't exist. And especially when you get into psychotropic medications, there's a plethora of side effects. And these are realized by so many people. So they're temporarily altering chemistry, which again can help some people. I get it. It can help. All right. But you're dependent on that. You would think, hey, we can take a medication for maybe in the next 6 months we should be able to wean off of those with our prescribing physician's help, and my depression should be gone. That's not the case. In fact, again, if you take a look at this documentary, Making a Killing, you'll see the underlying reason why that is not the case. And it's sad to say, but it comes down to greed and money. But anyway,
and
so
pain
let's.
medications too, and pain
Oh
medications
yeah, of
cause
course.
so now that I'm looking at, and after our consultation this morning about how my brain is changing as a result of neurofeedback, I wonder, have you done the work with someone who is on medication and through neurofeedback have been able to get off medication? Is
Oh
that
yes, many
possible?
times. Yes.
Okay.
Yeah. Yeah. And I will add a little disclaimer, and I always discuss this on a personal level with my clients or patients, but I will never determine how, or I always have them refer back to their prescribing physician, especially with medications like antidepressants. You can't just stop those. You have to titrate or wean off of those.
Sure,
But
sure.
as they're doing their neurofeedback and their brain is now functioning better, which the medications were not doing, they start to feel better. Then they are able to, and I've worked with plenty of people that have been able to come off their anti-anxiety medications, antidepressant medications, off of their medications for ADD and ADHD. I mean, that's almost a given as long as they do their part. And here's the reason why. So our brain is electrochemical in nature, but predominantly electrical. Okay, so we just imagine our brain from a structural standpoint. Let's go back to structure. Our brain is comprised of billions of nerve cells we call neurons. And these neurons make these intricate, very complex dynamic connections. These are electrical connections. So for those of you that can see my hands, but if you were to envision this in your car, listening to the podcast, you've got these neurons that have a small space between them, and they send electrical charges from one nerve cell neuron to the next. We call that a synapse, the space in between an electrical charge. It's electrochemical in nature, but it's mostly electricity. That's how our brains predominantly work and how they function. And this is all measurable through EEG, as I mentioned before. And the type of EEG that I do in my clinical practice is called a qEEG. The Q stands for quantitative. So it's an EEG nonetheless, but we delve a little bit deeper into each region of the brain, be able to map that out, which is what I reviewed with you a little while ago. And we can actually see colors that represent where our brainwave activity, because that's what we're looking at when we measure through EEG. We're looking at brain waves. That's how our brains function. And we can actually see the voltage output. So our whole body is electrical nature, but especially our brain and our heart. So we can actually measure what's called the microvoltage output of our brain in the different regions of our brain, and we can identify that and map it out. And as I reviewed with you, you got to see your map of your head basically with the different parts of your brain, and you got to see the different colors that represented where your brain was putting out too much microvoltage or too little. And you would think, as we discussed in our talk together, that more would be better. In this case, it's not. Just like with blood pressure, we don't want more blood pressure. We don't want too little blood pressure. We want this optimal normal range. Same thing with brain function. So EEG, qEEG, in my opinion, is still one of the best ways to really get a sense of why a person is suffering with either cognitive and or emotional and or behavioral problems.
Yeah.
Okay. Plain and simple, because we're measuring exactly what's going on from an electrophysical standpoint. And that's the whole premise of, and this has been, again, well established. This is not new science. This is not new technology. This has been well established in neuroscience for many, many
Yeah.
years.
Yeah.
Yep.
Yeah. Well,
Yeah.
I have been blown away after our conversation today. And by the way, for those of you who would like to an insight scoop on my conversation with Dr. Silva, I actually recorded. We're in the process of putting together the video, the slides, and we've already done that, but we haven't listed it yet. It's going to be unpublished or unlisted, I guess. And so if you would like to see my first visit and my second visit and compare the two and how my progress is, you can email me at lily@whenyouneedafriend.com, or you can text me at 407-373-5959, and I'll send you the link. If I don't want to give you this information if you're not interested in the information, but if you're interested in learning more and finding out more about my journey, you can reach out to me either by text or you can email me, because this is life-changing for me. This has become something that's life-changing. So if you're interested in what the possibilities are for you, I encourage you to go to whenyouneedafriend.com. While you're there, please subscribe to the channel. That way you know when Dr. Silva is going to be on and what we're going to be talking about, if this is something that is piquing your curiosity, because I know that a lot of people have a lot of hope with that pill. But as you know, my registered server's mark is you can take a pill, you can take responsibility. And it's not that I'm against the pill, is that I am for doing everything you possibly can before staying on a lifelong pill journey. Maybe a short-term journey is what you need to get you through that trauma or that crisis. But unless you change some of the things in your body and your life, that's going to continue, and that pill's not going to support you the way it supported you to rescue you as an emergency. As a matter of fact, it could cause more problems. It could reduce your lifespan, all those things. But if you are interested in it, just reach out to me, and I'll be more than happy to share these videos that Dr. Silva does a great job at explaining what's going on with my results. And this last one that we did this morning is basically him explaining to me and comparing, contrasting how the improvements from what I'm doing is creating some changes in my brain and also my life. So go to whenyouneedafriend.com. Again, subscribe. Also, like and follow me on all social media, including podcast and BitChute, which are, I guess, not considered social media. It's just an internet, these other forms of mediums that you can, platforms, I guess is what they're called. And so go check them out. Please subscribe, like, and follow. Like this video, share this video with your friends. You don't know who is just had enough about their behavior and they want to make a change, but they don't know how to make a change because their brain is not working with them. Their brain is working against them, and we just don't understand. And this could help find a way that you can work with your brain to create something different and new for you. So also check out my sponsors. Without my sponsors, like Dr. Silva, there would be no classroom. And of course, support them as they're supporting the classroom as well. You can also go to my Shop Now bag. These are all Lilly approved products, whether it's a affiliate link, which helps provide a little substance for the classroom, or something that I don't make any money of because I just want you to know the importance of it. Please go to the Shop Now bag and figure out ways that you can help support yourself and the classroom. It's a win-win. It's a win-win. Last but not least, you can become an enrolled student in the classroom, and whether you want to tithe or contribute to the work we're doing, the costs have gone up exponentially since they've been censoring the podcasts, and us as hosts as well. They've been censoring us with information. The costs have gone up exponentially. So if you can help, whether it's $1 or $1,000 a month or a one-time donation to the classroom, whether it's your time, your talent, your treasure, please give, and give generously. And so today we are so excited to have this aspect. And as Dr. Silva said at the beginning, the brain is, it controls everything. The brain and spine control everything in our body. And so how wonderful to see the pictures and the images today of how my brain has changed from what it's releasing. So when you're saying, and by the way, for those of you who would like to get a hold of Dr. Silva, you can go to drjohnsilva.com. If you are a subscriber, you already have that information. You can just click on his name, and or you can call him at 772 494 2576. Although Dr. Silva is in Port St. Lucie, Florida, he sees people from all over the world. He can do this virtually, or you can drive and do what I did for my qEEG. I went to his office and we got to spend some time together, him putting gel in my hair so that I could had a brick in my head for a day or so. I had to brush it out. As a matter of fact, it works better if you brush it off than you try to clean it off, and was able to clean it off after I worked out. So, but Dr. Silva, I want to thank you for everything that you're doing to help not only my brain health, but also for those that you're helping all over the world.
Yes, thank you. And I want to thank you for giving the opportunity for those that are interested in sharing your experience, your journey, the pre and post or the interim brain maps that we just did the other day that we reviewed earlier on our previous call. So I think that's a wonderful thing you're doing. Awesome. And we're going to
Yes,
continue following your journey and documenting that and sharing that with those that are interested.
absolutely. And again, for those of you who want to be a part of my exploration with Dr. Silva, my consultations. These are my private consultations. I'm willing to share with you, but you need to do something. You've got to do something for yourself. I'm not just going to give it to you. You need to email me or text me. So you can email me at lily@whenyouneedafriend.com. It's right there, right there. Or you can text me at 407-373-5959. This is just you taking care of yourself. We're also talking about doing a webinar and having people come in and have a Q&A and have an interaction with Dr. Silva. So this is all that we're things that we're talking about for the future. So stay tuned on this. So Dr. Silva, as I am learning more about the brain and I am looking at how I'm feeling and what you're doing, when you talk about the neurons and that they're shooting the synapse that you're talking about, is that delta? What is it that what is it that it's saying to each other? What are the
Yeah,
messages that are being
yeah.
sent?
So these electrical connections are what form our memories, again, our emotions, our behaviors, and they become kind of hardwired over time. And it's what, again, makes us who we are and unique as individuals in but again, when these electrical connections are not behaving properly or functioning properly is when we start to have an upset in that proper balance of our cognitive functions, emotions, behaviors, and such. And this is measurable through qEEG or EEG. And when we look at brain function, we measure again in brain waves. And you may have heard the concept of delta brain waves, beta brain waves. So what we looked at together were maps that actually outlined your entire brain and the different parts of your brain and showing you specifically how your delta brainwave activity was doing, how your theta brainwave activity was doing. Was it too high or too low in certain places? And through decades of neuroscientific research and qEEG and EEG technologies, and my system actually takes into consideration data input from functional MRIs and even SPECT scans. We compute all that data and we're able to see because, for instance, high alpha brainwave activity in this part of your brain can then potentially manifest in these cognitive issues or these behavioral challenges. So it really starts to shed a lot of insight as to why a person is struggling, well beyond just having a 10-minute consult with a doctor saying, oh yeah, based on what you told me,
Yeah,
you have XYZ diagnosis, here's the XYZ drug, I'll see you back in 3 months. You're
yeah,
going to know specifically where it's coming from, what part of your brain, to what extent, to what degree your brain's not functioning
brilliant.
with that delta, theta, alpha, or beta brainwave activity. You'll have it there in a report. And then more importantly, that also helps to then determine how we get your brain to start functioning better. And that's where neurofeedback comes into play.
Yeah.
And that will be another topic again that we will cover. But neurofeedback, since we're closing up, uses qEEG technology, but now instead of using it so-called diagnostically to map out brain function, we now use it therapeutically to start training your brain into more normal brainwave activity. So for instance, if you were to visualize Lily's maps that we reviewed this morning, one of her primary features was she had a lot of elevated alpha brainwave activity. I call it the brain on fire condition because it was an image of her head and brain all red and yellow, which indicate her brain alpha brainwave activity was too high and very high. It looks like a fire, brain on fire. And we were able to see today with her interim brain maps, we saw a diminishment of that red and yellow. In fact, even started to see some gray come through.
Yeah.
She accomplished that through doing home-based neurofeedback sessions, which basically are using a process called operant conditioning. Again, tune in for our next, and we'll go a little bit deeper dive into that. But basically, we're training her brain to start self-regulating, how to function better. And the coolest thing is she got to sit back and watch educational videos. I think you started watching some series on Netflix, or I forget
Yeah.
what. But the person chooses what they want to watch, and their brain is receiving feedback to regulate itself. It's non-invasive. It's easy to do. Kids especially love it. They get to watch movies and YouTube videos.
Yeah,
So if you
exactly.
have a child suffering, this is so much better than them taking their morning medication. They love it. They'll actually ask for it.
Yeah. Well, before we go, because we only have a minute left, before we go, what is the cost compared? Because the cost, the price of psychotropic drugs can be death. I mean, because it could lead, the side effect could be suicidal tendencies. What is the cost, the financial cost to doing this at home? Because people might think this is really cost prohibitive.
It really isn't. I mean, on a payment basis, which I offer to all my clients, it can range anywhere between, say, on the low end, $95 to $350, just depending on how much therapy you might need over what duration, and if there's any other therapies that we may have to work or do in conjunction with neurofeedback. But
Yeah.
it's usually not cost prohibitive for most people, most families. Yeah.
Yeah. I am thrilled, and I'm thrilled to be able to share this with all of you. Please share this video with your friends, because you never know who is suffering silently. They're trying to compensate, like I was trying to compensate for some of my deficiencies, especially after my accident. And it's stressful on the body. And so please help each other out by learning more about this non-invasive therapy that you can do in your home. So thank you, Dr. Silva, for everything that you do to help our bodies function better. So thank you.
You are very welcome. Look forward to continuing our journey.
Yes, and please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. John Silva, wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. Good job. That was awesome.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.